Hello.
Hello.
Okay. Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Doctor, my name is Anna Caroline and I am 69 years old.
Okay, how may I address you?
Please call me by my name, Anna.
Okay, Ms. Anna, today I'm going to discuss about your health issues. Is that all right with you?
Okay, doctor.
And during our discussion, I might take down some notes, which will be strictly confidential. Is it all right?
Okay, doctor.
And now, Mrs. Anna, can you please tell me what has brought you here today?
Doctor, I have been admitted into this hospital for last 4 days, and today morning I developed diarrhea.
Okay. Okay, I'm very sorry to hear. Uh, and you told that you have been facing this problem since today morning. Am I right?
Yes, doctor.
Okay. And may I know that how many times have you opened up your bowel today?
5 times from the morning.
5 times. Okay. And can you please tell me about the consistency of your bowel movement? How is it? Is it all right, or
It's
is it
liquid,
soft
doctor.
or liquid? Okay. And have you? What is the color of it? Can you please tell me?
Just like normal color, but more fluid.
Okay. And have you noticed any blood in it,
No,
mixed or frank blood?
no,
Okay. And okay. And have you felt any pain around your back passage when moving your bowel?
no,
Okay. And anything that you felt that is making it worse or better since morning?
no.
Okay. And okay. And can you please tell me that have you feel that it's difficult to flush away or something like that?
No,
Okay. And any association with food? May I know that previous yesterday, did you have anything unusual? Any unusual food?
no. I took the food from the hospital supply.
Okay, that's all right. And do you have any tummy pain?
No,
Okay. And any nausea?
not much.
Okay. And any vomiting?
No,
Any difficulties in while taking food?
no,
Okay. And any yellowish discoloration of your body?
no,
Okay. And now let me ask you some more questions. That do you have any headache?
no.
Any changes in your vision?
I have diabetes. For that, I have some problem with my vision.
You have diabetes. Okay. And for how long have you been diagnosed as diabetic?
About 15 years back.
15 years back. And what was the type of it? Can you tell me?
I don't know.
Okay, that's all right. And diabetic patients uh, sometimes have some problem with their eyesight or kidneys or their function, body function. Are you well aware of it? I think you
Yes, doctor. I
are.
have I have lots of problem also.
And okay. And is your so do you go to the respective doctors regularly?
Yes, doctor. Now I have been somewhat regular with the doctors.
Somewhat regular. Okay. And how is your diabetes control nowadays? Do you know about your HbA1c level?
Yes, doctor. It was 8.
Oh, so I'm okay. So it was actually quite uncontrolled till now. So actually, do you go to your eye doctor regularly?
Yes, doctor. They said some problem with my eye.
Okay. And are you receiving any treatment for that?
They did laser therapy once.
Okay. And how is your eyesight now after the laser therapy?
Still, I have problem with my vision, but it is manageable.
It's manageable. Okay. And how about your water work? Is it all right?
I'm passing more water than usual
Okay. For how long have you been passing this?
for last 3 months.
Okay. And have you seeked any medical attention for that?
Not for that particular issue.
Okay. And okay. And do you think there is any fraudulence in your water work?
No,
Any difficulties in your speech or swallowing?
no,
Any skin rashes?
No.
Any soreness in your mouth?
No.
Any weakness in any parts of your body?
No.
Any abnormal sensation anywhere?
Yes, I have abnormal sensation on my legs and on my hands, and it's more now.
It's more now. Okay, okay. And okay. And have you seeked any medical attention for that?
Yes, doctor.
And what medication did they give?
They gave me amitriptyline and pregabalin, but that is not controlling my symptom.
Okay, okay. I'm very sorry to hear. And may I know that do you have any chest pain?
No.
Any racing and pacing of your heart?
No.
Any shortness of breath?
No.
Any cough?
No.
Any noisy chest?
No.
Any raised temperature recently?
Yes, doctor.
Okay. Can you please tell me more about it?
Uh,
When
about 7 days
suffered?
ago, I developed fever, and that was high grade fever. I visited my GP, and he said that there are some problem in my lungs. That is something might be due to bug, and for that he referred me to the hospital.
Okay. And you told that you have been admitted for the last 4 days.
Yes.
Am I right? And since I reckon that you are getting some medication in the hospital.
Yes, doctor gave some
So,
medication from my blood, and I don't name. I cannot name.
okay, that's all right. That's all right. That's totally all right. Please don't bother. Okay. Previously, at the time of having some raised temperature, did you have any trouble with your bowel movement? Did you feel any?
Yes, doctor.
Can you please tell me about it?
I had some problem that I that was something like I developed constipation for a few days, and after that I developed diarrhea for a few days.
Okay. For how long have you been feeling like this?
That maybe for around plus 6 months.
Okay. I'm very sorry to hear. And do you feel that you get full quite early while taking food?
Yes, doctor.
Okay. Okay. I will get it. And okay. And do you have any night sweats?
No,
Okay. Any okay. Any lumps anywhere in the body?
no.
Any weight changes in your weight?
I lost a few kg weight over the last 3 months.
Okay. Was it intentional or unintentional?
Unintentional.
Okay. And any weather preferences?
No.
Okay. And no weather. Okay. And may I ask you some questions now? That do you have any funny color changes in your hands? Have you ever noticed?
Doctor, I had also a thing called scleroderma. I don't know what does this mean.
Okay. Okay. For how long have you been facing
Like
this?
7 years, for the last 7 years.
Okay. And have you seeked any medical attention for it, or do you take any
Yes,
medication
doctor,
for it?
I am taking a special medication, and I cannot name that at this time.
Okay. 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 That's all right. And do you have a how about that control of scleroderma? Are you under a regular monitoring or something like that?
Yes, I am under regular monitoring. They say that it is somewhat satisfactory.
Okay. And you told that you had been under medication for the last 4 days, I think. How do you feel about your chest now?
I am
Are you
okay.
feeling better now?
I am okay, doctor. I don't feel any problem now. I don't have any so
Okay,
much
okay.
raised temperature and so much chest pain. I don't have any of the symptoms now.
Yeah, I can get it. And may I know, just you told that you had some problems like diabetes or scleroderma or something like that. Can you please tell me about any more disease condition that you have?
I
Can
have
you remember?
high blood pressure also.
Okay, for that, which medication do you take?
Remicade.
Ramiprid. Okay. And is it your pressure under control now?
Yes.
Okay, that's all right. And apart from Ramipril, I guess you are taking some medication for scleroderma.
Yes.
And may I know that what medication do you take for your diabetes?
For diabetes, I take metformin, linagliptin, and insulin.
Okay. Has there been any recent dose changes of these?
Yes, doctor. There was now I am taking metformin 2 gram daily.
Okay. For how long?
Last 15 days.
That's 15 days. Okay. Okay. And now, may I know that are you allergic to any other medication?
No,
Any any over-the-counter medication?
no,
Any herbal medication?
no,
Any medication through your blood channels?
no,
Any blood transfusion?
no.
Okay. Do you have anybody in the family with similar type of condition or any condition would you like to mention?
Yes, doctor. My mother had bowel cancer.
I'm very, very sorry to hear. I'm very sorry to hear about it. And may I know that uh, uh, okay, and may I know that what do you do for your living?
I'm a retired person. Previously, I worked as a school teacher.
Yes, yes. Do you drive?
No.
Okay. May I ask you some personal questions?
Okay.
Okay. Do you smoke?
No.
Okay. Do you drink alcohol?
No.
Okay. Do you take any party drugs or any recreational medication?
Never.
Okay. I'm very sorry to ask. Okay. And may I know that have you been to any travel recently?
About 6 months back, I went to USA to see my daughter.
Okay. Okay. I can get it. And till at the time, did you had any bowel trouble?
No.
Okay, that's all right. And may I know whom do you live with?
I'm living alone here.
Okay. And may I know that do you think that you need any economic help or social help in your life?
Not this time. I think I can manage everything.
Okay. If you want, we can involve the social services. Okay, to help you out a bit more. Will it be okay?
Okay. 2 minutes remaining.
Okay. And okay. And you have been in the hospital for the last 4 days. Well, just may I take some opinion from you that have you noticed that there is any unhygienic practice like the staff not washing their hands or using some dirty objects or not changing the bed clothes or something like that? Have you just noticed anything like that?
No, doctor. I don't think any
Okay.
of them with their hygiene.
Okay, okay, that's all right. Please don't mind. Okay, okay. So at this moment, may I ask what your concern is?
Just I had diarrhea before, but this time I think it's somewhat different, and I am having more frequently. Is this different?
Okay, actually, at this moment, I have to examine you thoroughly and also do some blood test. But at this, as long as I've taken history from you, at this moment, the diarrhea, the loose motion that you have been having, I think that it might be caused by a bug infection in the bowel, in your tummy, named Clostridium difficile. Okay. However, there are very strong possibilities of some other causes as well. Like your diabetic control is not that much satisfactory. It can be a cause. Sometimes that your scleroderma can be a cause, and also, although we will also have to rule out. I'm sorry to say that some bad growth in your bowel or some bowel cancer. We have to exclude that as well. Okay, by doing some tests. In this matter, we will actually form a multidisciplinary team. They will run the test, uh, examine you, and we will get to you as soon as possible after doing the test. Okay. And at the same time, since you are under our admission, we will take very good care of you so that you don't get worse. Will that be okay for you, Ms.
Doctor. So that
Sana?
are you going to do anything special with me right now because I am so much tired of going to the toilet. Time up.
Okay. Okay.
You can give the answer.
Okay. At this moment, actually, I will talk with my consultant as soon as possible. And what happens that in times of loose motion, your body sometimes loses too much fluid, so you can get weak. We will examine you and at the same time, if we think that as you were telling that you are very weak, we will try our level best to give some medication or some fluid through your blood channels, okay, to ease up you a bit. Okay. And even we also might give you some saline as well. Will that be okay?
Okay, doctor.
Okay. And would you like to know anything more?
No, thank you.
Okay. Hmm.
So you want to examine this patient?
Yeah, I would like to examine the patient. First of all, I would like to expose the patient. Okay, and then I would like to ask whether there is any tummy pain present or not. Then I would like to feel the tummy, whether any tenderness present or not, or any organomegaly I could appreciate or not. And afterwards, uh, I would like to look at his eyes to look for any eye symptoms, any light reflex, and also his field of vision. And then I would like to have a look at his oral cavity and also uh, and also I would like to look at his plantar reflex and plantar and knee jerk and plantar and knee jerk and I would like to complete the examination. I would like to listen to his chest and whether any bronchial breath sound or anything present like at this moment, and also to his heart and feel his pulse. Okay, and also I would like to have a look at his arms, both arms, whether there is any arms and legs, whether there is any injury mark present or not, and about his cannula site, is it okay or not. Okay, and I would like to complete the examination by doing fundoscopy, urine for dipstick test, and also measuring blood pressure.
Okay. So have you noticed that any diagnosis?
There actually are, at this moment, there are quite a few differences. However, since his very recent onset, two differentials would be very more probable. First of all, would be Clostridium difficile induced uh, diarrhea, and then I think there can be the recent change of metformin. This metformin induced diarrhea, I think, may be a cause as well. And there are other diseases like diabetic autonomic neuropathy, small bowel bacterial overgrowth due to scleroderma, and even considering her weight loss and some changes in his bowel habit. This can be both due to diabetic autonomic and may also be due to bowel cancer. Okay, I think these would be my DDs
Any
in this
other
patient.
bowel, any other infection in the bowel do you suspect?
Yeah, yeah. I think other infections like tuberculosis, HIV, giardiasis. Okay, this can also be
Okay. We
suspected.
can suspect some unusual atypical bacterial organism that is causing the pneumonia and diarrhea, like Legionella.
Oh, sorry, I just couldn't remember that, but it is a possibility.
So how will you investigate it?
Okay. Okay.
One thing
At the
that
beginning, I will have.
will you consider any other endocrine condition?
Yes, I think thyrotoxicosis carcinoid. This can be important. Medullary carcinoma of thyroid can be important.
So they are unlikely because it is the acute onset.
Yeah, pheochromocytoma can also be present.
Not likely. Okay.
Okay. Okay. So first of all, I would like to do complete blood count to look for any anemia and also for any neutrophilia or lymphocytosis. And also, I would like to do inflammatory markers like ESR-CRP to rule out any inflammation. Then I would like to do serum creatinine, serum electrolytes, and then liver function test and stool routine microscopic examination and blood culture and stool culture as well. Um, and then I would like to do plain X-ray abdomen anterior posterior view ultrasonography of whole abdomen, and then I might then I would like to after after doing the acute management, I might go for a colonoscopy and biopsy or sigma. If not viable, then flexible sigmoidoscopy may also be thought of. I think these are the main investigations.
Okay, urinary antigen for Legionella, have you mentioned that?
No. This should have been.
Stool for Clostridium difficile toxin.
No, I told that routine microscopic examination. I think that should be included. These should be included. Stool for ova, parasites, and Clostridium difficile toxin.
I don't know. I think it is a special one.
Yeah. I would tell. I should have told it separately. I think you stool routine microscopic examination, stool searching for ova parasites in the stool, and also CDT toxin. These all should be told separately. I think.
Okay. So, how will you manage this case?
Okay. I think it would be first of all patient education and counseling. Then I would have to form a multidisciplinary team in this patient involving endocrinologist, uh, endocrinologist, then medicine specialist, respiratory physicians, a respiratory specialist, and rheumatologist as well. And after that, first of all, we will have to settle down the patient, and then according to the cause and specialist opinion, we have to go for further management. I think this patient.
Okay.
Okay. So, would you like to criticize?
Okay, there are something that I should mention that patient had diarrhea when he was admitted into the hospital. So at this point, you would have just asked that how do you feel now? Can we start? Can we continue the conversation right now?
Mm. Yeah.
Because patient is acute diarrhea and she may have some discomfort at this time. Okay,
Yeah. Mm.
and you could take some more detailed history about past medical condition.
Okay.
For how long?
How I think I did ask some questions about diabetes, scleroderma. I think
Yes,
I
and
don't know how.
there were some medication, and were there any problem with medication like insulin induced any hypoglycemic attack previously or any insulin site injection problem? You could have
Okay.
asked
Mm.
any, and also you should have asked about the dietary habit
Yeah. Yeah.
because
Mm.
changes in the diet sometimes may cause this type of problem. If she had any problem with the diet, any special diet previously.
Yeah. Mm.
Otherwise, I think
Okay.
everything's fine.
Okay. Well, may I ask that what is the what was the case actually in this case?
Okay,
What was it?
this was not a clear-cut diagnosis. There were certain possibilities, and all the possibilities should come forward in this case.
Okay. So what I think I told that CDT infection and metformin dose changes were the prime my concerns, prime concerns. Was it right?
Yes,
Okay. Okay. And and other were also right. Am I right that his
yes,
recent
yes.
weight change bar? Okay.
All the differentials are correct.
Okay. 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 So about management, was it all right?
Management was all right that the patient has developed diarrhea, and at this time, some acute management. You should have told that acute management like maintenance is yeah, like emergency management, like maintenance is fluid status, maintenance is electrolyte status, frequent monitoring, and also frequent
Yeah.
monitoring with the diabetes because patient with insulin developing diarrhea, they can develop more frequent hypoglycemic attack, and also review of the medication right now.
Okay.
Like a review of the medication of metformin and other, that should also be kept in mind, and also that she is taking some medication for her pneumonia, so that should also be reviewed. You should have mentioned that also.
Okay. Fluid status, electrolyte status, generalized well-being, and
First, maintenance
medication
of
that.
general care, then review of the medication.
Yeah.
That is
That's
urgent.
very much important.
Suppose
Yeah.
it was the cholesterol deficit induced diarrhea, then at that time continuing the medications like penicillin, ciprofloxacin, or third generation
Mm-hmm.
cephalosporin. That is somewhat um, uh, doesn't
Okay. Yeah,
cover.
I can get it. Yeah. Okay. So that's all right, I think, for this case. Okay. So